Addiction and mental illness are often described as personal battles, but behind every struggle is a family, often hurting, adapting, and trying to hold things together. Today, psychiatrist Richard Bradlow joins us to uncover how one person's illness can reshape an entire family and what it takes for everyone to manage and recover. Welcome to Monday Matters. I'm Ian Bunston. Good morning, Richard. Great to have you back again and chatting about such an important issue.
Thanks for having me, Ian.
Richard, when one person in a family struggles with addiction or a mental health condition, how does it typically affect the emotional and psychological well-being of those closest to them?
Yeah, obviously it's awful. I think as any illness is awful, if a loved one gets a serious chronic illness like cancer or motor neuron disease, also is going to have a disastrous effect on the mental health of our loved ones. I guess what makes mental illness perhaps trickier is that it can be harder to differentiate the illness from the person. And people can often come to me, say especially with something like a psychotic illness, and they'll sort of talk about how they are so hurt by how the way that their loved one is behaving, and it's very hard to differentiate, well, that's not their loved one acting in full capacity and really being who they are. So it can be really hard to differentiate the person from the illness. And I guess attached to that is that a lot of mental illness can be really hard to treat, and so this problem can go on for a long time. I think it ties into sort of the ongoing difficulty we have in understanding mental illness and addiction, which feeds the stigma, which just makes it all much harder to understand. And if we don't understand something, then it's much harder to sort of live with and place in our minds. So it can have a really, really disastrous effect on the family.
So, Richard, in your experience, what are some of the most common ways family members try to cope or adapt? And when can those coping mechanisms become unhealthy themselves?
Yeah, I think we talk a lot about everyone having their role. So I think obviously we love our family members so much and we want to help them. And again, if to go back to the example of, say, a family member, let's say if my son got diabetes when he's young, the expectation would be for me to manage his diabetes. But then around his teens to early 20s, that shift of responsibility would go on to my son in managing his chronic illness. But because of the sort of amorphous nature of mental illness and addiction, and because of the difficulty we have understanding it, that can get blurred, and you often see family members continuing to manage someone's, or try to manage someone's illness as that person gets older. And I guess the difficulty there is that mental illness, impacts the way we make decisions around looking after ourselves, and sometimes we're making the wrong decisions. And of course, you want to help your loved one from getting into trouble, so we get drawn into having more of a sort of management role later and later in that loved person's life. And I guess the issue is sometimes that's needed, right? If I don't have capacity to be looking after myself, I absolutely need help doing that. But I guess the problem there is it can stunt my ability to then create the independence and the capacity to be looking after myself. So it's a really tricky line to walk. And I guess it's something we do all the time with our kids and our loved ones. We stop our 4-year-old from running into the street, but we don't hold back our 24-year-old, because we know our 24-year-old won't just run into the street. So we slowly let our children and our loved ones gain independence over their life. But when something like mental illness or addiction gets in there, we can get drawn. The lines can get blurred, and that sort of that individuation that we see happen over someone's teens and 20s, that can get slowed or even reversed. And that's not healthy for anyone. It's not healthy for the loved one. It's not healthy for the person with the illness. And then it can end up sort of prolonging unhelpful, or what we probably call maladaptive behaviors. I think specifically in addiction, it always comes up, but not just addiction, but I guess all mental health, but specifically in addiction, it always comes up. People are concerned that they are um, enabling an addiction, right, by certain behaviors. And there's this line between I can either be enabling an addiction by being too acquiescent to any request, or I can be encouraging the addiction by being so robust in how hard my boundaries are that I'm making that person's life worse. And if my life is worse, I'm going to be more likely to engage in my addictive behavior to sort of numb myself from it, right? So I think there's this line that I think families are always walking between, trying to either not enable but also not encourage it by being too harsh. And I think in my experience, I'd say the latter is much more common. People are often so afraid of enabling that they're too harsh, and then doing stuff like kicking a loved one out of the house is encourage the addiction, make their life worse. So it's a really hard line to walk. And I guess then the other thing that we often see is with people with psychotic illnesses that perhaps the public mental health system is not engaging with due to issues around funding, or however the current Mental Health Act, or however problems whatever problems arise. Just trying to get help for a loved one is also incredibly difficult right now. And it's not uncommon for people to come see me just for advice about how to access help for their loved one, which can be really, really tricky, because if that person's not willing to engage in care, it can be really hard. So that I think it's about, because I guess the one fear is we're too hands off and this is all on you, and that leaves the loved one with an addiction or a mental illness, completely struggling and without help, or we're too in taking on all responsibilities, and that leaves the loved one with an addiction or a mental illness not taking any responsibility in their care and in getting better. And again, likewise, that's going to not lead to them getting better. So it's walking a very fine line, and I don't think we ever hit it. I think it's really important to have people that we can talk to about navigating that.
So Richard, I'd say that there'd be a lot of people listening today who have a family member in this situation, and they're really struggling, really battling as to know how to cope. They're an important part of the recovery process, I would imagine. So do you consult with them, advise them? I think you've alluded to it already a little bit.
Yes, absolutely. Look, so and again, family dynamics are so tricky, and ultimately it's up to the patient and their relationship, because obviously the patient gets to decide who they include in their treating team. But ideally, you'd always have family involved. But obviously, if someone says, "I don't want my family involved at all," then you're violating doctor-patient confidentiality to do that. But I would, yes, especially if a loved one has a major mental illness, or a chronic mental illness, then I really think that if you're not very involved in the care and knowing the treating team well, then having your own advisory, mental health professional to help you navigate the system, because it's incredibly difficult. Even me working in the system recently had to try and get a friend into a hospital, and it took me about 3 or 4 months of quite a lot of advocating to get this person who's quite unwell into hospital, and I have I can pick up the phone and call the psychiatrist that works in that particular hospital, or call the whoever needs to be called. So it was a big moment for me to think, geez, this is I couldn't imagine what this would be like if I didn't have the connections I had, and even still it was a bit of a battle. So it's really hard, and having supports and being involved in the treatment is really, really important. Because I guess, and it's hard, but it's there's a phrase by a famous English psychiatrist in the mid 20th century who said it's not enough to love our children. We have to be a good enough parent, and we can love our loved ones and want what's best for them, but we might be, because we are unaware of what we're doing, making matters worse. It's not about just loving, it's about making sure that what we're doing is having, the best intentions can sometimes go awry. So having someone consult and say, oh, is this the right thing to do, can be an incredibly useful thing.
Mm. And I'm sure that parents would want or have the best intentions for their loved ones. Are there any, to keep a sense of balance in all of this from the parents and other siblings for that matter point of view, are there any warning signs, any indicators where they may be losing their sense of balance with the support of a loved one?
Yeah, I guess that's really tricky because it's obviously um, it's so dependent on the situation. I think that what we need is to have that sounding board, because I don't think it's about losing the balance, but just about where, and especially so if we've got a sibling, we're trying to protect our sibling, or perhaps we're trying to protect our children whilst also looking after our sibling with a mental illness, or it's we're always doing this juggling act. And I think just about having that sounding board to say, we're doing this, we're going down this road. Is this the right thing? I think it's why as psychiatrists we work in groups and peer groups, because sometimes in a therapeutic relationship we go down the wrong path because of the way the treatment has gone. And it's really good to have that sounding board or have that supervision that says, oh, actually, what we're doing, you seem to have got yourself down this path. We need to reshape things. And there are great services out there that are specifically for so every public mental health service will have a unit that is for families of people with mental illness or children of people with mental illness. There is a great service out there called SHARC, SHARC, that is for in Victoria, at least, that is for family members of people with an addiction. There's Al-Anon, which is a service it's a peer support service for people with family members of people with alcohol use disorder. So there are lots of services out there, and there are lots of psychologists and psychiatrists out there that almost exclusively see family members of people with mental illness to try and give advice. And I think it's that sounding board. It's not that the person you're talking to really has often done. It's not that they have really what they are saying, but it's you saying it out loud to someone that's more neutral and that's just going to can ask resetting questions. Is this where we want to be going? That sort of thing. But once you hear it out loud, I think, oh my goodness.
Now, just to pick up on that expression you've used as a sounding board, and to maybe just even to move outside the medical profession, for family members who are really suffering and having the challenges that they would have outside the medical profession, what would be your advice to the connection with social groups or confidential people that they can, again, be able to express some of the frustrations that they would have?
Yeah, absolutely. So some of those groups that I was mentioning before are terrific, sort of like Al-Anon or the SHARC service is also another. It's a peer support services essentially. So it's groups where we go and we talk, and it's all other people in a similar situation. And that in itself can be amazing, just to hear similar stories, because we get stuck thinking that we're all in this alone, and just to hear that other people are in a similar boat and hear their stories can be incredibly helpful.
Hmm. So, do you think, and you've already touched on this to some degree, do you think that our current mental health services provide enough support for these families? And what changes would you make for the biggest difference for them?
I'm always hesitant to, because I think the current world is very filled with people saying, there's not enough service, there's not enough funding for mental health services, and I'm sure that is definitely true, but I'm sure there's not enough funding for every service, and I don't want to sound, so self-centered working in mental health, saying there's not enough for my particular service. I think that there could always be more. Yeah, it's tricky. I think, as I said, there are these great organisations and services out there. I said every public mental health service will have a specific worker for, sort of a counsellor, peer work, as a counsellor, or also caseworker for family members of people with mental illness, and service for children of people with mental illness. So I think there are services out there. I'm not sure they're doing a good enough job of making people aware that they're out there. But I think that there can obviously always be support. I think the other really tricky part about family members of people with mental illness is obviously that it can obviously the family dynamics can often be very tricky, and sometimes and then going back to whether the patient wants the family involved, and obviously the patient has final say over whether that's the case. So it's a really tricky thing, and whilst it could definitely be better funded, I think that probably just needs to be more awareness of the services out there and awareness of the potential limitations of those services. I think ultimately, family members, having a loved one with a major mental illness or a chronic mental illness is a traumatic experience, as you said, and I think you can always reach out for your own counselling, for your own support, perhaps external to those things, sort of a private counselling. Blurs the lines less in terms of whether it would be a better thing for expanding existing services for those looking at you as attached to the patient rather than going through your own difficulties because of the difficulties of having a loved one with mental illness. I'm not sure. I think perhaps having that would be a better frame, would blur less boundaries and enable the person with the mental illness to hold on to more autonomy and more privacy about their own struggles.
And Richard, one of the huge challenges of this whole area is the longevity of and the recovery for someone with mental issues. And I'm sure that we've got people listening today who are accessing these resources, accessing even folk outside the medical profession for support groups where they can talk and use this as a sounding board. But I'm thinking of the area for those who have exploited all of those areas, are still feeling very frustrated in terms of their self-care. What would you advise them in that space to be really making sure that they're looking after themselves?
Yeah, yeah, and it's awful, and I think as I said, recently having dealt with some services, it can feel very Kafkaesque. I think that self-care in general just comes down to what we know is good for us in general. So making sure that we are looking after ourselves. That means abstaining from or limiting our drug and alcohol input, getting regular exercise, meditating regularly, making sure we're getting good sleep, making sure we have a life outside of something like having a loved one with a major mental illness can be all consuming. So making sure that we are putting some boundaries in place and having a life outside of that, making sure that we're able to socialize and get purpose in our life, that doesn't become an all encompassing sort of beast and take over our lives completely, which is, we can get guilty when we've got a loved one suffering if we're doing anything that isn't worrying or looking after them. But we also need to be able to have our own life and our own quality of life.
Well, Dr. Richard Bradlow is a psychiatrist and specialist at the Victoria Clinic and now the Director of Medical Services there. It's been really insightful talking to you this morning, and thank you so much for being a guest here at Monday Matters today.
For having me in.